So regularly, patients during hair transplantation, there are going to be like two main stages with one half time. What happens is that everything starts with we actually do a fade cut of the hair. This does not need to be shaved if we're going to be grafting here. If
And
we're going to be
here, and
harvesting from
for the people listening,
yes,
where here is like your front
exactly. Your
of your
like yeah,
forehead.
your hairline and your where the receding hairline. So we're not going to be shaving that area where we're going to put the hairs in. We're going to be shaving the area where we're going to be harvesting hairs. And for women, what we do is we allow and we do it in layers so you don't have in a gentleman it's easy to shave the back, and then in a couple of weeks it's going to be like a very small haircut, very short haircut that patient got. But on women, it's important that for women to know that it's not they're going to be shaved on their back. We do it in layers so you can have, I mean, people will see you from the back and they cannot
They
tell.
won't
You know,
know.
of
Yeah,
course, if you
what's going
lift up
on.
the hair, you can find those areas, but if
Right.
nobody does that, it's fine. So that's the first step. And then we numb things up. We know where the nerves that provide sensation to the scalp are. We give you what we call scalp block. So think about it when you go to the dentist, they numb up the area where they're going to be working. And then we ask the patient to be facing down while we start harvesting. We determine the areas where we're going to be harvesting. We numb all that area. And patients, once everything's numb, they are so comfortable that some of them actually take a nap or they
Oh,
fall asleep. Then there's a short break because that basically takes about 2 to 3 hours, depending on the number of follicles. But then there's a short break because by that time, it's going to be like 11:30, and then patients can actually have a little bite, some lunch. And then after that, the next part would be designing the hairline, exactly understanding and knowing where we're going to be putting that hair, estimating how many follicles are going to go here, how many follicles are going to go there. And then after that, what we do is we numb up the part where
the front.
the follicles are going to
Yeah.
be coming. Once it's all good and numb, again, same thing. Patients are very comfortable, and then they're sitting facing forward, just like imagine like in a lawn chair, the grafting starts. So meaning bringing and putting the follicles at where they're going to be living in their new address. And then
The soldiers in their new barracks.
that's
We'll
exactly
stick
right.
with
Where
the
they're going to
analogy.
be, we're going to be consistent. And then what will happen is that pretty much at about like depends anywhere from 2 to 33, 3:30. Then we're finishing up, and then we put some of the bandages that we need. I mean, don't think that it's going to be big and bulky, but it's something just to protect, and mainly to protect the areas where we harvested those follicles. And patients feel fine. Patients at the most, they feel like maybe a little tired, like maybe like some tension in the shoulders. It's rare that they complain of pain. Sometimes maybe a little bit of a headache. That's what they refer, but that's it. It's a light headache, nothing else. And then they come back the next day for us to change those dressings for them. And pretty much the next day, everybody feels at 100%.